Historically, Oklahoma's agency tasked with helping people with mental illness and addiction issues has been underfunded. This year, the governor is asking the legislature for a big hike in money to pay for treating addiction and mental illness. In this It's Your Government segment, we look at the work done by the Department of Mental Health and Substance Abuse Services and the challenges the department faces.
Does mental illness conjure up images of disheveled men and women aimlessly wandering along downtown sidewalks? Does the term substance abuser bring to mind a drunk or meth user sitting stoned on a curb? The State Department of Mental Health and Substance Abuse Services is charged with being the state's safety net for people with mental illness or addiction. Its Commissioner Terry White says the face of addiction and mental illness is different than many people believe.
The face of mental illness and addiction looks like me, looks like you, looks like our brother or our sister, our friend or our neighbor.
Oklahomans have the second highest rate of mental illness in the nation. Our second leading cause of workforce absenteeism is untreated mental illness. And our state has one of the highest rates of prescription drug abuse.
I'm good, thank you so much.
Kimberly Cummings is one face of mental illness and addiction. Sober and healthy, she's executive assistant to the director of Oklahoma's second largest nonprofit organization. Before treatment, she was a meth addict, alcohol abuser, homeless person, and convicted felon.
I did use for 23 years.
The actual average gap from the time first symptoms show up for mental illness and someone gets treatment is between 6 and 23 years. If you could imagine going with untreated asthma or untreated diabetes for 6 to 23 years, we'd all be outraged. But that's what's happening in our state right now around mental illness and addiction, and I'm hopeful we'll be able to narrow that gap just a little bit this year after our legislative session.
Cummings' substance abuse was a way to cope with untreated PTSD, post-traumatic stress disorder.
I was born into a life of chaos. There was a lot of dysfunction, a lot of addiction. It was a very poverty-stricken time.
I think there's still a lot of misunderstanding around what mental illness and addiction actually are and what services looks like. Mental illness and addiction are diseases.
Diseases that can be treated without putting patients into big state psychiatric hospitals, as was once the custom. In the 80s and 90s, hospitals like Griffin Memorial in Norman were closed or scaled back in favor of inpatient or outpatient treatment in local communities. Michael Brose, the executive director of the Mental Health Association of Tulsa, supports community-based care.
And it's an investment in the community. It's just much less expensive to provide people high-quality substance abuse care, high-quality mental health care in the community and keep people stable. They have an opportunity to work, pay taxes, be law-abiding citizens and what have you, but they need access to care.
The Department of Mental Health and Substance Abuse Services contracts with private, not-for-profit agencies to provide community-based services.
Only 2.7% of our budget is actually spent on administration. Over 97% of the dollars, the taxpayer dollars that we receive, are out in local communities preventing mental illness and addiction or treating mental illness and addiction, which means we're saving Oklahomans' lives.
Still, many Oklahomans, especially those relying on state help instead of private insurance, don't have easy access to treatment. There's a shortage of providers and facilities. White says that means 80% of youth with substance abuse issues don't get the help they need. 70% of adults needing mental health or addiction treatment can't get it in Oklahoma. And 40% of school children have untreated mental health issues.
Here's the amazing thing about mental health and addiction. Those diseases can be as successfully treated and more often even more successfully treated than most other forms of disease. But the big problem that we have in the state of Oklahoma is we have a huge gap between the number of people who need services and the number of people who actually get services.
Even if there were enough facilities, White's agency doesn't have a big enough budget to pay for it.
We have high rates of mental illness and addiction, but we're actually funded 46th in the nation. So second highest rate of the disease, 46th funding per capita in the nation. And we've had not only decades of underfunding, but about 4 years ago, we had some pretty massive cuts. We had about $30 million ripped out of the mental health and substance abuse treatment system when we had those cuts for the last few years.
White says the consequences of untreated mental illness and addiction cost taxpayers far more than treatment. especially if that person's addiction or illness lands them in jail or prison. In her State of the State address, Governor Mary Fallin called for giving back about half the funding the agency lost during the state's budget crisis.
I'm proposing a $16 million increase to the Department of Mental Health and Substance Abuse for a variety of programs, such as the Systems of Care Initiative to assist children and families of children with emotional disturbances.
Last year, the legislature approved funding that paid for 2 new crisis centers, one in Ardmore, the other in Tulsa. White says the state needs at least 5 crisis centers, but even one more would help. The funding increase also would target suicide prevention.
And for the first time ever, I'm proposing in my budget that we allocate new funds for suicide prevention.
The governor also wants more money to battle prescription addiction.
Currently, 81% of drug-related deaths in Oklahoma are caused by prescription drugs. One survey shows that nearly 8% of Oklahomans are abusing prescription drug painkillers. That's twice the national average, and we're better than that.
The legislature will have $212 million in additional growth revenue to allocate this year. It's now up to them to decide whether some of that money will go to increased spending for mental health and addiction treatment and prevention.